Hey there, welcome back. If you're in your 40s and 50s and your periods are going haywire, your mood is all over the place, and your sleep, forget about it. You're likely in perimenopause. Hey, I'm Dr. Rika, your functional medicine MD, board certified in family and integrative medicine. Today, I'm tackling a huge myth that you need birth control pills to fix your symptoms. Spoiler alert, you don't. And in fact, they're targeting the wrong root cause. Now let's dive in. Let's be honest, conventional medicine often treats perimenopause like a birth control problem. You're still getting your period, so they hand you the pill. But the symptoms you're dealing with, hot flashes, anxiety, poor sleep, irritability, heavy bleeding, those aren't caused by a birth control deficiency. They're caused by hormonal imbalance, specifically by progesterone deficiencies as your ovaries start winding down. I'm going to dive into the 5 reasons you don't need the birth control pill. Reason number 2 will shock you. The first reason you don't need the birth control for your perimenopausal symptoms is birth control pills mask and don't solve perimenopause. The pill overrides your natural hormone rhythm. It suppresses ovulation, flattens your natural cycle, and gives you a fake bleed each month. That makes it hard to know if you've even reached menopause. It's like putting tape over your dashboard warning lights. It doesn't fix the engine. The second reason you don't need the birth control for your perimenopausal symptoms, they increase health risks as you age. After 40, your risk for blood clots, stroke, and heart attack naturally rises. Adding synthetic estrogen and progestin from the pill, that raises this clotting risk even more, especially if you have other risk factors like smoking or high blood pressure. These are risks you shouldn't have to take to manage symptoms. The third reason you don't need the birth control for your perimenopausal symptoms, non-hormonal therapies work, and they're getting better. Not everyone wants or needs hormone therapy. You can naturally support progesterone with an agent that helps support its production, like chasteberry, and even use supplements to support the clearance of estrogen with supplements that contain DIM, like my signature product, She Balance. I'll pop that link in the notes. Let's not forget about lifestyle changes. Think regular exercise, better sleep hygiene, mindfulness, and avoiding alcohol, as all of these have major effects on symptoms. Don't underestimate the power of foundational health. The fourth reason you don't need the birth control pill for your perimenopausal symptoms. Women thrive when they feel in control, not medicated. Studies show that women using natural or alternative therapies often feel more empowered, more informed, and more satisfied with their care because they're not being pushed into hormonal control they didn't ask for. This isn't just about symptoms, it's about your autonomy. The fifth reason you don't need the birth control for your perimenopausal symptoms. Bioidentical progesterone targets the real root cause. Here's the heart of it. The dominant hormone deficiency in perimenopause is progesterone, not estrogen. And birth control pills don't replace your natural progesterone. They actually suppress it even more by suppressing ovulation, which normally triggers progesterone production. Bioidentical progesterone, not synthetic progestins, can calm anxiety, improve sleep, regulate cycles, and reduce heavy bleeding. It supports the body instead of shutting it down. This is one of the most promising root cause therapies for perimenopause, and it's shockingly underused in mainstream care. You deserve better than a prescription that covers up symptoms without actually solving the problem. Perimenopause is a transition. It's not a disease, and it can be navigated with real support, real answers, and 0 birth control pills. Thanks for watching.